when last year did COVID-19 start to sort of come across your desk and become a serious consideration for AIC?
So I recall, particularly in the run-up to the circuit breaker period in Singapore, where, because of vulnerability for the seniors were assessed to be higher, they were asked to stay at home, not to come out. And, we were then asked, firstly, to really step up to support, to contact and support the vulnerable seniors.
Welcome, Cheak Tan, to the Rolling Stories podcast. I do appreciate you making the time today to speak to us. So, AIC, interesting organisation to be with, and that is really the theme of our discussion today. But as I do with people that join us on Rolling Stories, I did a little bit of stalking on LinkedIn. I thought we might just start the discussion today with just a little bit of a flyover from you about your career.
Yeah, thank you so much for having me, Philip. A little bit about me. I started my career in the Singapore Public Service, and I've been through quite a number of different ministries as well as agencies like the Jurong Town Corporation, as well as the Ministry of Education, Defence, Manpower, so on and so forth. I then went to join McDonald's Singapore, which was one of the most interesting period of my careers. And in McDonald's Singapore, I was responsible for operations, for HR, as well as business planning. Spent quite a significant proportion of that in HR, which is really my passion in terms of a professional area. But of course, now I'm in the Agency for Integrated Care. I've been here for close to 4 years now.
The Agency for Integrated Care, because as I mentioned to you, I'm relatively new to Singapore, but I'm not sure a lot of people know that the government has a specific agency looking after the older generation. So is it a government department, or is it an agency attached to a government department?
AIC is an agency that is under the Ministry of Health. We have a very clear mandate to focus on our aging population, to help to engage and care for our seniors, particularly in the phase of their life, as well as the caregivers. We are relatively new in terms of our history of development. We have been around for now 11 years, working with different parties. So this is something that we've been doing, yeah.
COVID-19 does not need an introduction. It's on the tip of everybody's tongue for the last 18 months or 2 years. But I can imagine, and as we will discuss in the next sort of 10, 15 minutes, trying to navigate COVID-19, both in terms of delivering the service to the elderly population, but also trying to marshal and coordinate and keep safe your employees and your volunteers must have been a great challenge. So in that respect, then, when last year did COVID-19 start to sort of come across your desk and become a serious consideration for AIC?
So I recall, particularly in the run-up to the circuit breaker period in Singapore, where, because of vulnerability for the seniors were assessed to be higher, they were asked to stay at home, not to come out. And, we were then asked, firstly, to really step up to support, to contact and support the vulnerable seniors. We step up to actually support these vulnerable seniors. We delivered food packs to over 20,000 of them. We also arrange home care services. We arrange errand runs for those who may need certain, tasks to be performed. And we also, pivoted to what we call a tele-engagement. For the other seniors, we make calls, where they are a bit more tech savvy. We then use video conferencing to keep in touch. And, that was a really intense period where to be honest, Philip, the main worry was, seniors out there whom we may not be aware, right, who needs help. And they might not have anyone or, might not know how to reach out for help. So I think that's where our volunteers, our 3,000 volunteers, as well as our staff, really sort of ramp up, and step up their effort to actually reach out to help and support. And where, with precaution, we actually reach out to them at home, deliver food packs, make sure, the care and support are there.
So it sounds like between your network of volunteers and other people volunteering from the public service, or almost just making sure that everybody's accounted for, right? And if I heard you correct as well, I mean, so actually the distribution of food packages during that time as well, particularly as you said, to the more vulnerable people that couldn't, potentially look after themselves. I mean, again, a mammoth effort. Did you have some sort of, I don't know, war room or something within AIC sort of coordinating? How did you set that up?
Well, it's a virtual war room with a small team on site to monitor, to actually look at the various needs that arise and to be able to link them up. And it's a good thing in the sense that actually it wasn't something that we established just during this crisis period. It's actually what we do during peacetime, the capability that we establish in terms of the last mile outreach, our understanding of our seniors and their needs, our ability to actually be able to reach out to them becomes absolutely important. We also had, our own crisis management committee that meets at that point in time daily, and where we sit down, we coordinate efforts, we look at where the focus should be. We also pull in, where needed, other support from the ministry as well as across the public sector. And recently, so we do ramp up and sort of scale down the efforts according to the situation, so that we're able to also manage the workload and the stress on our staff, which, as you can imagine, is a sustained battle. It's not easy to actually be able to manage. But important for us to continue to be vigilant. We continue to monitor the situation and, focus on actually both, I think, managing the current situation, but now importantly, sort of prepare for the future while we actually transit out of this and what we actually need to do for the new normal going ahead.
With the vaccinations going up and so forth, right, there is light at the end of the tunnel. I think we're all agreed there's light at the end of the tunnel. So practically for AIC then, today, this week, is it yet back to sort of business as usual in terms of support, or is there still a very heavy COVID?
What I mentioned earlier was just one part of what AIC has pivoted to focus on, right, during the COVID-19 period. The other two parts which are also important in our view, firstly is our support for the community care service provider. So we worked very hard together in the ministry to actually put in place infection control practices, COVID-19 related measures to safeguard the residents, the client, and the staff. We actually supported readiness assessment. We distributed PPE, protective equipment out to the service provider. We conducted surveillance testing. We are now actually still in the midst of, sort of rolling out surveillance testing. Particularly in our nursing homes, because as you will know, given the profile of the residents there, which tends to be older, they tends to be those with condition, they're more vulnerable. We are really, really careful to make sure that we are proactive in identifying if there are cases and to ring fence and make sure that it doesn't impact on the residents there. So, and now we also are in the midst of working with our partners, the service provider, in terms of rolling out the vaccination exercises as well. The third part that AIC does is work with our general practitioners. That's another part of our role. If you can imagine, our role is out in the community, outside the hospital, our partners out there at the local level. So we have been working with GPs as well, supporting their clinic operations in terms of their needs for protective equipment, masks, preparing them to be able to carry out testing, and also helping them to be able to roll out vaccination as well at the clinics. So all these efforts still, takes up a lot of our time and our focus. Having said that, we are also refocusing our attention on what we need to do, post, of course, COVID-19. And some of the areas that we have said we really need to put in place to be able to help and enable our seniors to live well.
With your HR hat on, I can imagine very long days, stressful work and so forth. How would you say AIC has dealt with with its own staff. What's the internal AIC sort of employee story over the same period?
It is and has been and continues to be a really challenging period for all of us in AIC. Firstly, in terms of us reorganizing, restructuring ourselves to support the COVID-19 effort. But having said that, we also needed to then pivot quickly and sustain the hybrid mode of working, particularly work from home. And it has been challenging, from an engagement, from a continuity, from a support perspective. But we have spent a lot of effort making sure basic sort of IT infra support is there. We are able to actually allow them, to stay at home to be safe. I use the virtual platform, what we call the workplace, right? If I can as well, well-being is really important. Particularly, again, we don't have the physical way of engagement, sensing how people are. We actually focus even more effort in terms of maintaining physical well-being and in particular mental well-being of our staff and employees. So we ramp up efforts in terms of reaching out, offering opportunities for them to participate in the activities virtually, physical as well as mental, for example, mindfulness training exercises. But we also have an employee assistance program as well in place for them, for our staff, if they want to talk to someone outside the organization. So the overall support for physical, mental, social well-being, is really, really important, and has been in the normal times, but during a crisis like this, become even more important.
Business as usual, I get it. It feels to me like so a lot of these things were because of the pandemic and because of the forced working from home and the separation, therefore, of physical contact, as I think we've all missed. You guys have come up with and put all of those things in place, knowing that people will be struggling at home to do their job, and knowing also that you guys in particular have a very important population segment of the population to look after as well, right? I don't know. Sounds to me immensely stressful.
To me, fatigue is a real concern. For us, supporting the front line, I think to sustain the effort, the engagement, the morale is really, really important. But I think COVID-19 has brought forth two things, right? One is the need to ramp up the efforts even more. The second part is, really being able to have a good sense, despite not, being able to meet people face to face. And how do we continue to do that? It has been quite a challenge. So it does require us to also try new modes of engagement. We tried virtual, we are trying, and we have rolled out virtual team bonding. Before this, I would say, we don't really sort of have those in place, right? I do think the social engagement, the team cohesion, bring people back together. Just being able to talk to each other, understand, and engage is still important. So for AIC, we are looking at moving to a hybrid mode.
So a couple of things to wrap up then. For all of those programs that you talked about, was that in fact coordinated through your HR function? I mean, there's obviously a lot of employee-related stuff there.
Yeah, so in terms of our sort of focus organizationally, we do work through both my HR teams, and we also have a dedicated engagement and culture team that's been set up earlier as well. But earlier, Philip, if you recall, I did mention that we have a crisis management committee sort of set up. That doesn't just focus and coordinate our efforts in terms of what we do for our seniors as well as our community care sector. It has a focus on us as an organization.
Sure. Is there, I don't know, Casey, I mean, there's many experiences over the last 18 months. Is there one story that you can think of about a staff member that went the extra mile or an outcome with one of the early generation that some of your teams or some of your providers are looking after? Anything stick out for you that you look fondly on in the last 18 months?
Yeah, and there are, I think, many of such stories. In one particular case, we were able to, reach out, knock on the doors of this senior for whom we are concerned with, right? Because, we have been trying to reach out through the phone, but we have not been able to get in touch. we've been trying to also get in touch with the senior through the senior activity center that is in the vicinity. But I think, at the end of it, the decision was made to, send two of our colleagues out to, check on this senior. And I was really glad that we did, because I think to a certain extent, this senior was isolated. It, is in real need, even basic meals, because, he was reliant on going down to the centers nearby for his meal, that we were able to then identify that this senior actually really needs help before it deteriorates to a state where we need to actually either send the person to the hospital or to one of the nursing homes. That we were then able to put in place both, I think, the meals on wheels, as we call it, to support this senior, but more importantly, check in regularly to make sure that he is okay. That's one. Two is, if I can, I recall the very first case that we had, which was in Liamway home, and it was in the news. There was quite a bit of an impact, because there were quite a few cases that there was a spread, although we managed to contain it. We had to quarantine the workforce within the nursing home. And if you can imagine, continuity of care is very important in the nursing home. It's 24/7. And it was really challenging time, right? Because, to have the workforce quarantine, to then have, the nursing home residents that actually amount to over 100 to be taken care of in a short period of time. The good thing was, which I'm really, really glad of, was that when we called upon the support from our other partners, who were all, of course, grappling with the measures, trying to make sure, there are no cases within their premises or the facility, is actually a lot of them did put up the hand to say, I will support, even if it's sending 2 or 3 of their staff down. Because they knew that, we were in the crisis mode in their home. We need to make sure there's continuity of care. We need to make sure that, we have sufficient workforce to keep the nursing home going. So other nursing home operators, community hospitals, they all, send in what we call the United Nations workforce. So, from all different providers coming together, bonding within a short period of time, coming together, coping, and making sure that we're able to continue to deliver the care.
Those are two, wonderful stories to end the discussion on. Casey, thanks for today. That's been, for me, that's been a great insight into, as I said at the start, a segment of the population that I don't think we, think about too often. And again, in the context of the pandemic of the last 18 months, some really interesting insights there. And although we were talking generally about AIC's role in helping, but yeah, some great things I think you've done. And again, all credit to AIC. So thank you very much. Again, I really appreciate you making the time. Look forward to catching up in the future.
Thank you so much, Philip. Really happy to be here. Thank you.